People with heart disease, those who have suffered a heart attack, and patients who have had heart surgery or other cardiac events often make significant beneficial strides through cardiac rehabilitation. On this week's Health Talk, Mary Boudreau, an advanced practice registered nurse and manager of cardiac rehab at Norwell Hospital, will share her observations from years of experience with cardiac rehab patients. So stay tuned, we're coming up next. Hi, I'm Dr. Eric Baser. Today our topic is cardiac rehabilitation, or more commonly known as cardiac rehab. My guest to discuss this very important topic is Mary Boudreau, an advanced practice registered nurse and manager of the cardiac rehabilitation program at the Chuck and Terry Tannen Cardiac Rehabilitation Center at Norwell Hospital. Did I get that right?
Yes, you did. It's very good.
Mary, that's a new, since I've retired from Norwell Hospital, so this is a new center you're running in?
Yes.
Tell us a little bit about it.
Okay, well, we've been very fortunate. We've been open since, it was June 2018 when we opened, and it's a beautiful, large facility on the first floor of the hospital. Previously, we were in a very small space in the cardiology
You
department.
always had a great program in a very small space, tucked way back in the back.
Exactly. So now that we have such a beautiful space, it's much easier to have do what we need to do in the cardiac rehab setting. It makes it a lot easier for us, to.
And I'm sure your patients enjoy the ambiance a lot more too.
Oh yes, it's really, really beautiful. We have a small track that goes around the actual cardio equipment in the center of the room, which is great for the patients for warm up and cool down. It's very bright. There's beautiful artwork on the walls. We have a nice window that looks out that you can see into the courtyard there. We have a nice conference room where we're actually able to do our education for the patients. So just in general, it is a beautiful space.
That's on my list. I've got to visit that soon.
Oh, you definitely need to do that, Eric. It's really something to see.
So, Mary, we've talked about, you've been a guest on the show before, cardiac rehabilitation. We've all heard of it. I guess I mentioned during the tease that virtually anybody who's had a cardiac illness or cardiac procedure is considered for cardiac rehab. But why? Tell us a little bit of what's the principle behind cardiac rehab?
Okay, sure. Really anybody that suffers some sort of cardiac event should come to cardiac rehab. It's a comprehensive program to help people recover from, primarily we see patients after a heart attack here from the hospital, but any type of cardiac event, and help them to recover from that and also prevent future cardiac events from occurring. So that would be people after a heart attack, as I mentioned, people who, for instance, just had an angioplasty stent placed, so anybody with coronary artery disease we would see, and also after heart surgery, so people who have had perhaps bypass surgery, or they could have had valve surgery repair or replacement. Patients with heart failure can come to cardiac rehab, and then other patients who just need some modification of risk factors. They would also be eligible in certain situations.
Is this something that's prescribed by their physician?
Yes, they need to be referred by their physician prior to starting, and then they'll come in and we'll do the whole evaluation.
So you do an evaluation and develop a program of exercise individualized for that patient.
Exactly. So that's in the outpatient setting. As we mentioned, we talked about the facility. They come in for their initial evaluation. We, either myself or one of our exercise physiologists who work with me, do that initial evaluation. It's a whole intake where we sit with them. We go over their history. We go over, their condition, and then we prescribe exercise for them. And the program actually is overseen by our medical director, Dr. Boris Scheinberg. So he signs off on all these exercise prescriptions for us, but they are developed by the staff and the patients.
And that's interesting. These are really exercise prescriptions.
Correct.
With heart, which is interesting because it brings me back when I started training. We thought very differently about heart attacks, and I remember distinctly you'd put somebody to bed for 8 weeks after a heart attack so their heart could heal.
Right.
thinking has really changed on that, hasn't it? I think there are probably still a number of people out there who think that, well, I've had a heart attack, I shouldn't stress my heart, I should let it just heal for a long period. And I remember we used to have people at bed rest for weeks. So go ahead, tell us.
Yes.
What's the thinking has changed? What's the evidence behind it?
Well, don't forget, you know, years ago we didn't have what we have now as far as the treatment of a heart attack. Let's say somebody comes into the hospital here in Norwalk Hospital and they're actually having an MI, a heart attack. They are, you know, if appropriate for that particular situation, whisked right away into our cath lab where an emergency angioplasty and stent is placed.
Which is opening up the artery. Maybe
Right.
just take 2 words, explain to folks who may not know what a heart attack is and what an angioplasty is.
Okay, so a heart attack or an MI would be the medical term myocardial infarction, is when the heart is being robbed of the blood supply to a certain area of the heart due to a blockage. So it's usually a blockage that was already there in one of your arteries of your heart, your coronary arteries, and a piece of the plaque, what we call, breaks off and completely closes that area. So the goal is to get into that area as soon as possible, to open it up, that's what the angioplasty is, and allow the blood flow to continue. The good news is that because we have this now, we're able to prevent that permanent damage that years ago we were not able to do.
Remarkably, in the old days, we literally just used to watch heart attacks occur. Put a patient in bed, give them morphine and oxygen so they're comfortable, and let that, and what would happen is during that time, that piece of the heart that was fed by that artery would gradually die. Now we know we can, in many patients, get in, open up that artery, and minimize the permanent damage.
Right. And that's why, like you were mentioning, patients stayed in the hospital for a much longer period of time then, because they did have to be watched carefully. And, you know, there was something to be said for the fact that, yes, they did have to rest more. But now that we, in most cases, don't have that permanent damage, we can get on with activity in life so much sooner. So that's really the big difference right there.
So let me ask you, and I'm just setting this up as a straw man, why not just go down to the corner gym and start exercising? What is cardiac rehab? And I know the answer to this, but tell us what cardiac rehab does differently than your trainer down at the gym might.
Okay, so when you come into the cardiac rehab program, you know, for the outpatient program there, the patients are actually going to be monitored in a very, they're exercising in a very safe environment. They're going to be on a heart monitor, which we're going to be watching the entire time that they're exercising. We're going to be checking blood pressures, and it's all being done in exercise prescription, as we mentioned, so it's an extremely safe environment. You're not going to find that at a gym, obviously.
Because some of the risks right after a heart event would be things like abnormal heart rhythms.
Right.
And they can be both from disruptive to fatal. And we can manage those.
Right, and that's that cautious period that we always talk about there, you know, like, well, we have to be very careful. Even though they didn't have permanent damage, you know, the heart is still affected. They have had a heart attack.
And it's irritable, and it can, and those things can happen. And then also, as you said, you monitor blood pressure. Somebody may feel faint. And then I think patients themselves, maybe you could say a few words about the patient experience, because I think my experience, and maybe it's changed in the modern era, is that patients themselves were nervous about getting back to exercise.
Oh, certainly. I mean, it's very traumatic after you've been told that you've had a heart attack, and just going through the experience of it, that pain that they were feeling, and, you know, what's going to happen to me. So yes, they need to feel that they are safe, and you know, even if they do very well, they're still going to be under that monitored, environment, and that really instills the confidence that they need to gain after they've had some sort of an event such as this. And truly we see a lot of not only just physical recovery, but emotional recovery as well.
Is part of the rehab program also sort of the emotional recovery, the dietary recovery?
Yes.
You do all that kind of counseling as part of this whole program?
Yes, so certainly the sort of the centerpiece of the program is the exercise, and then we have all these other things that revolve around that. So education is a big portion of that. And we have a dietitian on our staff. She's a registered dietitian. She does a monthly class on heart healthy eating. And she can also meet with patients individually who have comorbidities such as diabetes, heart failure, or perhaps they just need some help to lose weight. So we have that available to them as well. We also do classes on stress management, on structure, function of the heart medications, risk factors, because that's very important.
I'm pulling this out there. Sexual functioning, I know that that's an issue for some people afterwards.
Right, so that's a good point. That's something, any type of physical activity that you want to get back to is something that can put stress or strain on your heart. So that is something that does come up. We do address that when we have our, well, one-to-one conversations, but also we have a class on exercise principles. So it kind of goes into all that, and it's included in that, but people are very afraid to resume sexual activity. But it's very safe, so.
And as they go through this program, do they graduate? Do people finish? Or do they always do they come back for checkups afterwards? How does that work out?
Well, you know, they do graduate. Typically, the program is 36 sessions, or 3 months, give or take, depending upon goals and insurance and all those kinds of things, but that's the typical program. And then the patient really does need to, all patients have a goal as to how am I going to continue my exercise. So we do offer a phase 3 program, what we call, it's a maintenance program for patients who want to continue. It would no longer be covered by their insurance, but it's a self-pay program. And these are for the folks that want to stay in that sort of safe environment for exercise. They're not comfortable to go to a gym, and they want to continue in that way. So,
and can they stay in that indefinitely then?
They can stay in that indefinitely. Some of the patients, that comes as like a little club for them, because they become friendly with the other people that exercise with them and share information. And so yes.
This must, Mary, we've only got a minute and a half or so left for this segment. But you've been doing this for years and years. It must be very gratifying for you. Can you just talk about what it's meant to you? Because you must get to know people very, very well.
Oh, yes. Well, don't forget, we are meeting with people in a very vulnerable time of their life. And they're coming like typically 3 times a week, so you're seeing them on a regular basis. And, you are their support system, their emotional support system. And you are making a difference in their lives. So you see them, physically getting better, emotionally getting better, learning new things, knowing things is so important. So yes, it's truly a rewarding.
How did you get interested in this?
Well, let's see.
Don't remember.
So it is going back quite some time, but I did work in I pretty much always have worked in cardiology. I worked on what was called special care at the time, but it's like the progressive care unit, so critical care. We used to see patients, of course, after heart attacks when they did stay in the hospital for longer periods of time. And God bless you, much more involved with rehab right in the hospital, which we don't do so much now. But that's how I got interested in that. And, it was something that I wanted to pursue. And then when an opening became available, there I was.
And what are some of the longest duration patients you've had in the program?
Oh, geez.
I mean, are we talking about months,
I'd
years?
have to go back years.
Years?
Oh, definitely years, yeah. I'd have to go back a ways now. Probably 10 years or more.
Really?
Sure, yeah.
So that must mean a lot to the patients to stick with us for so many years.
Yeah.
They do some to get better, but then they're doing that to stay well.
Exactly.
Well, that's really so interesting. We've run out of time for this segment. I want to thank you for coming on the show. I want to thank Mary Boudreau so much for joining me on Health Talk today. And thank you for watching. Remember to share your questions and comments by emailing us at healthtalk@newvanshealth.org. So stay well, exercise, and there's always help if you have heart disease. Thank you.
Follow state and local guidelines, wash our hands frequently, and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
145 over 92.
180 over 111.
182 over 100. And I had a heart attack and a cardiac arrest, and then a stroke.
Your blood pressure numbers could change your life.
A lot of people don't understand, including myself, I didn't, now I do, the impact of having a stroke.
My memory is shot.
When I woke up, I couldn't speak.
If I would have followed a treatment plan, I would not be in this situation.
It's a tough journey.
Lowering your high blood pressure could save you from a heart attack or stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
It's a new life, but I'm gonna make it better. I'm coming back. Ask your doctor, check your blood pressure.
There are several graduated phases of cardiac rehabilitation. To recover from a heart attack or other cardiac event and to prevent complications along the way, it takes careful supervision, time, and effort. On this week's Health Talk, we'll focus on the phases of cardiac rehab with the manager of cardiac rehabilitation at Norwalk Hospital, Mary Boudreau. Hello, I'm Dr. Eric Mazer. Today we're going to explain the phases of cardiac rehabilitation and the importance of these phases. My guest today is Mary Boudreau, an advanced practice nurse clinician. Mary is also manager of the cardiac rehabilitation program at Norwalk Hospital. Welcome to Health Talk, Mary. It's so good to have you.
Oh, it's nice to be here, Eric. Thank you.
Cardiac rehabilitation, I think everybody's heard of it. A lot of people don't quite know what it is. Maybe you could just take a couple of seconds to introduce the concept.
Okay, sure. Cardiac rehab is a comprehensive program that is devised for patients after they've had some sort of cardiac event, such as a heart attack, heart surgery, heart failure perhaps, other cardiac conditions, to help them recover from this, both physically, emotionally, and really to prevent a future cardiac event from occurring.
So it's both recovery and future prevention.
Right.
People must be pretty scared after they've had a cardiac event, aren't they?
Oh yes, it's a very traumatic event in somebody's life, and they are truly nervous about getting back to their normal life prior to the event. So they need a lot of support along with physical recovery. And this is what we provide for them when they come to our outpatient cardiac rehab program.
Now this is a medical program, is that right? It's actually prescribed by their physician.
Correct.
So tell us a little bit about the process and sort of take us as a patient through the process, if you would.
Okay, so I could start with when we see patients here in the hospital. That would be phase one, what we would call cardiac rehab. And that's when we have our first contact with these patients after they've had their heart attack. Generally at Norwalk Hospital, those are the patients that we would see, where we would do some preliminary teaching on diet, on lifestyle modification, a little bit about what they should expect when they go home from the hospital, but also to be sure that they know about the outpatient program, because that's really when we do most of our work. So we want them to be aware of that and give them information about that.
Are virtually all patients who have had a cardiac event referred to the cardiac rehab program?
Unfortunately, that's not the case. We do capture the patients here at the hospital, but there is, and I'm not sure what the latest statistic is, but I don't know, maybe 30 to 40% of patients who are eligible for cardiac rehab actually come. So there's a huge population out there that's not being served.
Is it that their doctor isn't referring them, or that they don't want to come? Do you have any sense of what the obstacle is?
Well, there are a few things. I mean, it's partially referral, although that's come along through the years. Sometimes it's financial, even though insurance does pay. Some people don't have insurance, or they're underinsured. Sometimes it's just the resistance. They don't want to come, or perhaps scheduling. They know some patients have to get to back to work right away. So there's a variety of reasons, but certainly everybody should take advantage of it.
Does a cardiologist have to refer them, or could their internist or primary care physician refer them too?
Well, usually it's their cardiologist, but it does not have to be their cardiologist. It could be their primary care physician as well, or their health care provider to refer.
So if someone's referred to you, you either see them in the hospital or you see them for the first time in the outpatient clinic. What do you do?
All right, so when they come for their outpatient or phase two, what we call cardiac rehab sessions, we will meet with them once we've gotten a referral for their initial visit, where we would do an evaluation. We would set up an exercise prescription for them, what we call prescription for exercise. and then get them started in their program.
So let me, just to get this straight.
Sure.
So I, as a physician referring to you, would not have to know exactly what the exercise prescription should be. You'll evaluate the patient and you will recommend that to
That's right.
us.
The referring physician doesn't have to get involved in that. We have exercise physiologists on the team who are very
I guess the point I'm making is if I feel insecure as a physician writing that kind of exercise prescription, I don't really have to know that. I can still get my patients to use this service.
Exactly. All you'd need to do is refer to cardiac rehab, and then we would take it from there and move on with the patient.
And so the exercise is actually quite individualized based upon this this review of their medical case?
So yes, it's an individualized exercise prescription, which is evaluated at the initial visit there. They'll be progressed according to their conditioning level and other, other aspects of their care. And they will be monitored with a heart monitor while they're exercising, which will determine, different things. I mean, the heart rates, and then checking of blood pressure. So very medically supervised program.
And God forbid if there were an arrhythmia, an emergency, there are people there like yourself who can handle it, and the equipment is there to handle it as well?
Yes, we have the emergency cart right on site. We're located in the hospital. We're on the first floor of the hospital in the Tannen Cardiac Rehab Center, and everything is available to us for emergency care. We're all certified in advanced cardiac life support, and so it's a very safe environment.
And unfortunately, that has happened on rare occasions, hasn't it?
Yes, I mean, well, probably more often than you would think. We do actually have to send patients to the emergency department with symptoms such as chest pain, fainting, blood pressure changes.
But again, they're surrounded by experts
We're surrounded by experts, and it's very convenient because we can bring them right to the emergency department. We have had a couple of patients that it was more serious than that too, but at least we do have the emergency equipment. We have the resources in the hospital to get to that patient right away.
Can you give me an idea of some of the graded exercise that is prescribed? I mean, are they lifting, bench pressing 200 pounds or running marathon? Give me some sense of what do you start doing after you, and what do you work up towards?
Okay, so I would say that primarily we focus on cardiovascular, so aerobic type exercises. We have.
So this is not strength training.
No, but we can fit some of that in sort of down the line, and it also depends upon the patient, but primarily cardiovascular when we first start. Of course, that's anything where you're moving, such as walking, jogging, all those kinds of things, but we're in that exercise environment, so we have the exercise equipment for that.
You have treadmills and bicycles and things like that?
Treadmills, we have bicycles, we have upper body machines, armagometers, we have rowers, which are a big big favorite, the rowers we have. Ellipticals, so many different types of machines that we use. And we will set up the patient, we like them to use different pieces of equipment so that they are using different muscle groups to strengthen all those
cross-training?
Right, cross-training, that's right. And
how do you start somebody off? I'm sure they're not doing 20 minutes on an elliptical to start off with. How do you actually get it started?
All right, well, initially we have them do what we call, it's like a 6-minute walk, so we evaluate their actual conditioning level when they first start, and then we sort of take it from there. But don't forget, we run the gamut with the patients who come in. We have elderly population, and then we have very young population, so it's truly dependent upon what their exercise level is baseline, and then they're progressed forward according to that, so if that makes sense. And then the strength training piece, if they want to sort of integrate that into their program, that would come further down the line. But that also depends upon, maybe they had heart surgery, so they wouldn't be able to do those strength training exercises right away. So there's things that come into play in that way as well.
And this is covered by insurance generally,
yes.
This phase of training?
Right, so most insurance companies will cover. Depending upon what the patient's diagnosis is, there's certain diagnoses that are covered more often than others. So people who've had heart attack, people who have had some type of heart surgery, such as bypass surgery, heart valve replacement or repair, patients that suffer from heart failure. We've actually seen some patients after heart transplant. So quite a lot of patients. And most of it, Medicare would cover all those and the private insurances, but sometimes the private insurances would cover patients who are at risk for heart disease. So they might have risk factors that would predispose them to that. So that's another area that we see as well.
Now, the paid program is established with 36 weeks, did you say? Or 36 sessions?
Right, so the initial outpatient program is the phase 2, typically 36 sessions, depending on the insurance and goals and all those kinds of things. And then after that, if they want to, they can go into what we call the phase 3 program, which is a maintenance program. So that program would be an out-of-pocket program as far as expense goes. But many of the patients will continue on in that because they still want to be in that sort of controlled, safe environment. So, or they won't go to a gym. Such as our elderly patients, we see quite a few elderly patients stay on with us.
No, I could see as an older person how it might be intimidating to go and go to a gym and have to take the weight button and put it way, way up.
Exactly. that wouldn't be a good scene.
When you see somebody at the beginning of this 36-week program or 36-session program, how many times a week is it?
Usually 3 times a week, but we do have some flexibility with that. There used to be stricter guidelines years ago, but we can now, I mean, some patients can only come twice a week, so we'll flex that. Or some patients will come more often, and let's say somebody is out of work and because of their cardiac event, but they want to get back to work sooner, like a younger person. They can actually do it in less amount of time. So we've had patients even come 5 days a week.
So then I was going to ask, at the beginning of the program, do you set a goal for where you want that patient to be?
Yes, we set goals at the beginning. You know, pretty much everybody has the goal of getting into a regular exercise routine, but there might be some other things that they would be looking at, like perhaps I want to lose some weight, or I want to learn more about my heart, things to that nature. But the exercise is always, there's always goals set for that, and then you know, proceed from there.
Did you have any experiences with patients that were surprises or delightful? You know, any anecdotes you can share with us that are particularly fun?
I can't think of anything off the top of my head.
Because I said it must be very gratifying to see people go from frightened and frightened to get moving to back living a normal life. And maybe you should say a couple, we only have a couple of minutes left. Can you live a normal life after heart event?
Oh yes, you can definitely go back to your normal activities, whatever you did before. I mean, certainly that is individual based on the patient's condition. But pretty much can go back to everything that they did before. After they are in a condition to do that, they should be able to resume those activities. The only thing that somebody should never do again, that I always like to mention and point out, is snow shoveling. So that's, so people like to do that, believe it or not. I mean, be outside but we do see quite a few patients after a big snowstorm. There's something that goes on with no other activity, but the cold is primarily, you know, you're out in the cold, the blood constriction of the blood vessels and all. But lifting and standing in one position. So blood pools in the lower extremities and the blood pressure goes up from the lifting. You don't see that in any other activity.
And I think upper arm really puts a lot of stress on.
Yes. So
I was shoveling the other day.
You were?
I probably shouldn't have.
No, you shouldn't be. You have to hire somebody from the neighborhood.
Some of the young kids, right?
It's not as easy as it used to be, though.
I was surprised because I still think I think we all still want to think of ourselves as young.
I know.
And are not willing to accept the calendar and what that does to us.
Yeah, we're not old though.
I'd like to believe that, and it certainly sounds like what you do helps people stay young.
Yes, it does. It does. Yes, and you know, it's so true. I mean, we meet so many different types of people, and you know, age is you know, numbers aren't as important as how people do and how they feel, their conditioning and that.
Yeah.
Because we can have people that are very old that do very well, and then we can have young people with a lot of, you know, they're just very sick and they don't. So. And
you know, we don't have time for it now, but I bet it helps people turn their lives around too. That these kinds of events are very singular, and I think making people say, hey, you know, I'm not going to live forever, or hey, maybe I do need to lose a few
Right.
pounds.
It makes them pause. They're really in touch with their mortality, and it's almost like a second chance, especially for people who are not maybe living that healthy of a lifestyle.
And unfortunately, that's all we have time for. That's another topic for conversation. Please, if you have questions or comments, please share them with us by emailing me at healthtalk@newvancehealth.org. I want to thank my guest today, Mary Boudreau, who has been great on the show, and thank you for watching.